Welcome to the Explainer. Today, we're diving straight into the mechanics of that massive diamond-shaped muscle on your back, the trapezius. You know, if you've ever shrugged your shoulders, braced your back, or reached for something on a high shelf, you have this incredibly complex structure to thank. Let's get started. To make sense of this sprawling muscle without getting bogged down, here's our roadmap. We'll meet the trapezius, trace its origins, look at its three distinct insertions, map the nerve supply, see it in action, and finally, cover clinical testing.
All right, part 1. Meet the trapezius, the diamond on your back.
If you look at just one side of the back, the trapezius is this flat, triangular muscle stretching over the neck and upper thorax. But the name totally gives away the bigger picture, right? Put the left and right sides together, and boom, you've got this massive trapezoid. It's practically painting a giant diamond right across your upper back, and it's largely superficial, meaning it sits right beneath the skin, covering a really vast area. Moving right along to part 2, tracing the origins, a massive anchor. Just look at this list of origins. This muscle claims a massive amount of geographic real estate. I mean, it starts all the way up at the base of your skull, specifically the medial third of the superior nuchal line and the external occipital protuberance. From there, it travels down the back of the neck along the ligamentum nuchae, hits the spine of the 7th cervical vertebra, C7, and then just keeps going. It anchors all the way down the middle line of your back to the spines of every single thoracic vertebra. That is a continuous anchor line from your skull all the way down to the middle of your back. Pretty wild.
And as you can see here, this unbroken line of origin runs right down the center of your skeleton. It essentially blankets the entire upper half of your torso, sitting just above the latissimus dorsi, which, as you know, takes over the lower half.
So that brings us to part 3. 3 distinct insertions, 3 muscles in one.
By tracing the paths of these fibers, we see a really fascinating top-to-bottom sequence. Look at step 1. The superior or upper fibers originate high up and actually run downwards and laterally to insert onto the lateral third of your clavicle, your collarbone. Then, step 2. The middle fibers. They proceed almost perfectly horizontally to attach to the acromion, that's the bony tip of your shoulder, and the upper lip of the scapular spine. And finally, step 3, the lowest fibers completely flip the script. They originate lower down and pass upward and laterally to insert onto the deltoid tubercle of the scapular spine. It's an absolute anatomy marvel, isn't it? You've got fibers pulling down, pulling across, and pulling up, all within the exact same muscle group.
Next up, part 4. The nerve supply, dual wiring.
This muscle relies on a dual nerve supply, and I just love how the body separates these functions. On one hand, you've got the motor supply, the actual command to contract and move. That's driven by the spinal part of the accessory nerve. But, movement isn't just about contraction. Your brain needs to know exactly where your shoulder is in three-dimensional space at any given second. That is proprioception. And for the trapezius, those proprioceptive sensations use an entirely different route, the ventral rami or front branches of the C3 and C4 spinal nerves. So think of it like this. You've got one wire for power and a completely separate wire acting as a sensor, relaying spatial positioning right back to the brain.
Okay, part 5. Muscle actions and movement, putting it into practice. Thanks to those 3 distinct fiber directions we just talked about, you get 3 completely different everyday actions. The upper fibers team up with the levator scapulae to elevate the scapula, so think of shrugging your shoulders. The middle fibers, they work with the rhomboids to retract the scapula, drawing your shoulder blades together when you're bracing your posture, and those lower fibers pull downwards to depress the scapula. It's literally like having 3 separate muscles expertly coordinating to control your shoulder blade.
And here is that scapulothoracic linkage in action. The trapezius is manipulating the shoulder blade directly against the chest wall. All those movements, elevation, retraction, depression, and rotation, they all happen right here. Because remember, the scapula doesn't have a traditional bony joint rigidly anchoring it to the ribs. It glides. And the precise tension of the trapezius fibers is what guides that gliding motion safely and effectively.
Now this is a brilliant biomechanical threshold, 90 degrees. Whenever you need to lift your arm beyond 90 degrees, say hailing a cab or reaching for the top shelf in your kitchen, the trapezius absolutely has to kick into high gear. Specifically, it works with another muscle, the serratus anterior, to forcefully rotate the scapula forward, tilting the shoulder socket upwards so your arm can actually clear the joint. Without the trapezius, no joke, your arm would literally get stuck parallel to the floor.
All right, final section, part 6, clinical testing, feeling at work.
So, out of all those complex rotations, retractions, and depressions we just explored, what's the single, most effective, straightforward way for a doctor to test if the nerve supply and the muscle fibers are actually healthy? The answer is surprisingly simple.
Try this right now, wherever you're sitting. Pull your shoulders up into a really heavy shrug. Now, imagine someone standing right behind you, pressing down firmly on your shoulders while you try to hold that position. In that exact moment, you will literally feel the upper trapezius fibers firing up near your neck. Palpating the muscle while the patient shrugs against resistance, that is the gold standard clinical test.
As our source material explicitly notes, inability to shrug the shoulder is suggestive of muscle weakness. A failed resistance shrug is the classic red flag. If one shoulder drops while the other holds strong, that indicates weakness, which often points straight back to potential damage to that spinal accessory nerve we talked about earlier. It's such a quick, elegant test for an incredibly complex structure.
It's honestly incredible to think that a single, diamond-shaped muscle orchestrates so many vital actions in our daily lives. From the base of your skull down to the bottom of your ribs, it is constantly pulling, stabilizing, and rotating. So maybe pay a little more attention to your posture today. But it does make you wonder, if a single nerve injury can collapse this entire diamond and paralyze your arm above 90 degrees, how vulnerable are the other massive muscles we take for granted every single day? Keep exploring the mechanics of your own body, and thanks for joining me on this explainer.